Dr. Pauley here. Today we're going to talk about the Quadratus lumborum muscles. So, a lot of people commonly have lower back pain across these muscles right through here. And in many cases, it's not the muscles themselves that are the problem. A lot of times it's the deep core muscles that are actually tight instead, that are causing some tension patterns back here. We've covered that in other videos before. It's called the psoas muscle release. Check that out if you haven't seen it yet. However, it's important to take care of these muscles as well and to give them some relief. So I think that they go hand in hand. So it's important that we also give you some insight on how to work at home on these muscles as well. So if you've seen our other video on the psoas muscles, note that we've used like a softball or a large ball of some kind. Something that's definitely larger than a lacrosse ball, which is what most people use for mobility work. So we need something big. That's the point I'm trying to make here, to take care of these muscles. So we're going to use this alpha ball. We have these in the office. Tune Up Fitness makes these. They're great. Got a little bit of nice give to them, so I think they work a little bit better than just a softball. But if you have a softball, go ahead and use it. I'm sure it's fine. Here's what we're going to do. To take care of these muscles, we're going to take this ball and one side at a time, we're going to lay the muscle between our pelvis and rib cage, just to the side of our spine, about right here. Okay? So we're not going to be on the spine, we're going to be right beside it. And what I'm going to have you do is you're going to lay on your back, take that ball, put it right there, and you're going to roll into it. Now, this is not going to be feeling very good, especially if you have low back pain at the time. Again, we want to not be on the rib, but we want to be right below it. What you're going to do next is you're going to bend the opposite leg, and you're going to extend the same arm on this side overhead. So if you can notice, my leg and my arm on this right side where I am currently are extended. Now, all I'm going to do is I'm just going to relax on this ball and let my body sort of just disengage. So I don't want you all tight up here. Try to let those hips relax, disengage, let the head relax. And what you're going to do next is take about 10 what we call diaphragm breaths. That means we're going to try to make our belly raise when we breathe instead of our chest. Through the nose if you can. So big breath in, big breath all the way out. Over and over again. If you find that the chest is going, you're doing it wrong. So what I suggest you do is take your hand, put it on your stomach, or take an object and put it on your stomach, and when you breathe in, that should raise, and when you breathe out, should go back down. The key here is that you're expanding and contracting this diaphragm while that ball is in that low back. After about 10 breaths, I want you to start to use your elbow or hand from your other side and start to maybe kind of roll a little bit and pause where you have to, because it's gonna, if you have back pain, this is going to be difficult. Pause and continue that diaphragm breath. Over and over again. What I'm doing essentially is I'm rolling and pulling this ball across my back to other areas as I'm going. So I may start with it right beside my spine, but as I start to rotate my body, my lower half, I pause and I diaphragm breathe to loosen that up. We're essentially using pressure on the lower back, the quadratus muscles, and using our diaphragm to breathe in and out to sort of stretch and contract that muscle, okay? And that gets a little function back to it and also gets your rib cage moving really well. So you want to diaphragm breathe and all the way in and out. Try to use your nose if you can. You can also, as an option, add this little bend and straighten of the leg. That'll sometimes help the hip on the opposite side work itself out. And you rotate over a little bit more. Notice I'm keeping my torso flat and I'm just rotating as I go. Keep going. All the way. And when you get done with that, what I recommend you do is, before you do the other side, try to touch your toes. And tell me if that side you just worked on feels a little lighter. Even the hamstring a lot of times will feel less bound up, because maybe this problem here was creating this problem here. You also want to check how well you can extend back, and you'll find, just like I am, this side feels easy as heck to go back. This side feels like it needs work on now. So after I'm done with this video, I'm probably going to take the ball and work on my left side. So it's as simple as that. You basically just take a softball sized ball, put it on one side or the other, make sure you always do both sides, test and retest, but you want to lay on your back, diaphragm breathe about 10 times when you're on there, slowly rotate over, diaphragm breathe as you go, and then just continue to work on it. You'll find flexion extension works a lot better after that, and you'll also find this works a lot better for your low back than rolling up and down on a foam roller, which doesn't do a lot for the low back sometimes. So this is a great way to work on it. If you see any significant bruising or anything like that, maybe back off on what you're doing. However, if you're moving a lot better and you feel better, just know it's part of the process of recovering muscle, that sometimes you might get a little redness or even some discoloration. As long as it doesn't turn black and blue, I'm okay. Be aware that the kidneys are back here, so be aware of them. But for the most part, this is relatively safe. Just follow up with a healthcare provider if you're seeing any problems after you do this a couple times. Thanks, have a great day.